Hello and welcome to Askimo TV. We're talking today to Dr. Krishna Moorthy. Dr. Moorthy is a specialist in bariatric and upper gastrointestinal surgery. Hi, Dr. Moorthy. How are you?
Hello, Joanne.
Dr. Moorthy, today's topic is going to be the hiatus hernia. What is a hiatus hernia?
The hiatus is a hole in the diaphragm through which the esophagus or the food pipe comes from the chest into the abdomen. And when that hole in the diaphragm enlarges, and there could be different reasons for that, the stomach slips through the hole from the abdomen into the chest. And that slippage of the stomach, which could be very small or extremely large later on, that slippage of the stomach or the herniation of the stomach from the abdomen into the chest through the hiatus is known as a hiatus hernia.
What causes the hiatus hernia and who's at risk for getting this hernia?
We don't really know, to be honest with you, Joanne, but there are certain factors that can lead to a hiatus hernia. People who have high increases in intra-abdominal pressure, people who have done a lot of manual work and lift heavy weights. Every time they do that, they increase their pressure inside the abdomen. And every time the pressure inside the abdomen increases, it keeps pushing the stomach up little by little through the hiatus in the diaphragm. The other common reason usually is obesity. What obesity does is that the fat weakens the muscles and it enlarges the hiatus. And that, combined with the pressure inside the abdomen, leads to the stomach being pushed from the abdomen into the chest.
What are some of the signs and symptoms of a hiatus hernia?
Most patients with hiatus hernia won't even know they've got a hiatus hernia. It's usually very silent and asymptomatic. But the commonest symptom with a hiatus hernia is gastroesophageal reflux, which is a condition where acid from the stomach refluxes into the esophagus of the food pipe. Normally, this acid reflux is prevented by a valve, but when the stomach herniates into the chest, the negative pressure inside the chest has got a negative pressure, and that's how the lungs stay open, while the abdomen's got a positive pressure, and that pressure discrepancy causes the valve to remain open at all times because the stomach, that part of the stomach is now in the chest. And because that valve is open, the acid easily refluxes into the esophagus and causes gastroesophageal reflux disease, which is typically characterized by a severe burning sensation behind the breastbone.
How's the hiatus hernia diagnosed and treated?
The hiatus hernia is generally an endoscopic diagnosis, which is made at the time of an endoscopy, and there are certain criteria, and you can see the stomach having slipped through the opening in the diaphragm. And the other way is doing X-rays and barium studies and CT scans, which will show that the stomach is no longer completely in the abdomen, but is herniated a little bit into the chest.
And the treatment options for the hernia?
Usually, when we treat a hiatus hernia, what we're treating is the acid reflux, and not the hernia itself, because the patients are symptomatic from the acid reflux. However, there are some patients where a hernia may be so big that the whole stomach is up in the chest. And that stomach, especially when it fills up with food and liquids, can compress on the heart and especially compress on the lungs and cause severe breathlessness. And in those cases, that stomach needs to be restored back into its normal anatomical position in the abdomen.
What happens if a hiatus hernia is left untreated?
So the hiatus hernias, if they're causing symptoms such as heartburn because of acid reflux, can make patients quite miserable because heartburn is an extremely uncomfortable sensation. If that reflux persists, it causes a destruction of the lining of the esophagus and inflammation, and that can cause scar tissue and difficulty swallowing. Persistent acid reflux with hiatus hernias can cause a condition called Barrett's esophagus, and there is an association between Barrett's esophagus and developing cancers of the esophagus in the future. People with giant hiatus hernias where the whole stomach is up in the chest experience symptoms because of compression of the lungs causing breathlessness and compression of the heart.
Dr. Moorthy, just to end off, is it possible to prevent yourself from getting a hiatus hernia?
Unfortunately not, but I suppose simple measures could be, if you are overweight, you can try and lose some weight, and you, by doing that, could reduce the risk of developing a hiatus hernia.
Thank you, Dr. Moorthy. Thank you so much for talking to me today.
It's been a pleasure, Joanne.